Let's talk about A&E versus hospital mode. So currently we are in acute hospital, meaning that we're in the hospital version of System 1. But there's actually two versions, the hospital version and the A&E version. So I want to show you what the A&E version looks like now. How you get there is that you see this button that is blue with two arrows going different directions. That's called change. This is how you change your mode. When you left click on this button, you get a question that asks, do you want to change from acute to A&E mode? You can say yes, and you can see that the system is now in A&E mode. How you can know is that you now have a red A&E button that shows up in your action bar and a red A&E button here as well. Some of you may also see it to your left side. Now this button is where people mainly work from in A&E. If you left click on it, it takes you to your attendance screen. Anyone that comes into the emergency department, they get added to this log screen here. So let's break down the different parts. So first, you have your attendance log that you can see here. This is where all your patients are reflected. You can see your patient's name, you can see their arrival time, the total time they've been waiting, their age, their location, the persons responsible for them, and the primary reason why they are here, known as the chief complaint. On your left hand side, you have some filters. This first filter is a triage filter. What triage is, it's a way for doctors and nurses to know how urgent a patient is. And they have different categories that they can filter by. They can also filter based on who is responsible for the patient. So if a particular doctor or service is responsible for this patient, they can see that by filtering by this area here. If I choose a very urgent category, you can see that my list goes from many to just 2 patients. If I go to unassessed, meaning persons who do not have a triage category assigned, you can see that my list goes to 6 people. And I can see how many people are in my emergency room department overall by selecting all triage categories. If I select responsible party, for example, obstetrics and gynecology consultant, then I can see the patient that only they are responsible for. These filters are cumulative. What that means is that they combine together to change how your attendance log looks. So I am seeing the patients in all the triage categories that have obstetrics and gynecology as their responsible service. So that's very important to bear in mind, because some people might wonder why they can't see the entirety of their attendance log. And the first thing that you want to guide them to do is to check their filters to see if there could be some filter setting that is not allowing them to see what they want. Now I'm going to set it back to all responsible parties so I can see all my patients. If one selects a patient with a left click and right clicks on the patient, they have particular actions that they can take, which we'll go through in another video. If they double left click on the patient's name, then they can open the patient's record. And this is your basics on how to use your A&E attendance screen.